the Evergreen Media Network studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Treasure Coast Connector, connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. Treasure Coast Connector is the talk show, an online community where we put a spotlight on interesting local businesses and resources, then connect them to you, the consumers in the community. Everyone has an interesting story of why they do what they do. When we learn about what's happening in our own backyard and support local businesses, it strengthens our local economy. For details on the show, links to discounts, promos, past interviews, check out www.tcconnector.com. Well, many people don't realize that our overall health is affected by our teeth, or I should say that our dental health affects our overall health. And we're going to learn a lot about this. It is time to get on point with our dental care. Joining me in the studio today are Doctors Todd Botwin and Dr. Maria Zecca-Botwin, and they own On Pointe Dental Care, located on Royal Palm Point in Vero Beach. Welcome to the show.
Thank you. Thanks for having us.
Yeah, I'm so glad to have you here. Sorry about that little flub in the beginning, but I just want people to understand how our overall health is tied to our dental health. We'll get to that in just a moment. Before we start talking about your practice, though, what made the two of you want to become dentists and open up your own practice? Dr. Todd, may I please start with Dr. Maria?
Of course.
Oh, thank you. We'll go ladies first.
Okay, well, I started working for an orthodontist when I was in college, and it was just a part-time job. But I loved it. I loved the tools. I loved the equipment. I loved the materials. And when I decided to go to post-grad school, it was dental school. And then I went there and I found my best friend and my partner. And it's just been great ever since.
Oh, that's wonderful. And how about you, Dr. Todd?
Well, I've always wanted to be in healthcare. I've always wanted to help people. I've had a calling to that all my life. My brother was a surgeon as well. And I was going to work with him, be an oral surgeon. And I just decided to be a dentist and do as much oral surgery as I wanted to do. And we just love what we do, very much love. But really, I got to tell you the truth. My mother said I have two problems. She said I have mouth problems and I have feet problems. Which one do you want to take care of, and I'll pay for it?
Oh, no, that's adorable. I love these stories. That's why I asked this question, because there's always something usually cute behind everybody's business, a cute story. Okay, so I mentioned in the intro that our overall health is heavily connected to our dental health. Now, I told you before, like, what I learned about when you ignore, like, what from an uncle that needed a valve replacement because he ignored a toothache for too long. So I learned that lesson through someone else, but our overall health is tied to our dental health. A lot of people don't understand that. So please go into that and just tag team off each other on this one.
Well, I find that the mouth is pretty much like a quick reference guide or even a dipstick to your body. Diseases manifest themselves in the mouth, vitamin deficiencies, all things can be, not all things, but a lot of things can be, like I said, a quick reference. We see a problem and then we address it and say, you should go see your medical doctor and follow through on this.
And that happened to me. I had a patient come in. We did a beautiful aesthetic case, 6 full crowns on the top and 4 on the bottom. And he came in about a month later. He was always overweight, and I'm looking at his gums and they were terrible. And he said, these crowns, they're loose. And actually his teeth were loose. And I said, wow, how is this happening? And sure enough, I said to him, I said, I don't feel good about this. You need to go get a CBC done. And he did. And he ended up having diabetes. He didn't know. It was sudden onset, and he is, okay now, I think. It's been several years ago. But that's happened a lot where we'd had patients come in and their gums just didn't look right. And we would just order them to get a CBC with their medical doctor, and, they'd find something out, either heart disease or, blood disorder, diabetes. And that's true. It's a litmus test. We find out when things don't look normal, maybe it's something else.
Yeah, I do appreciate that. And I really want people to understand this, especially if people have been putting off going to the dentist for too long, which segues nicely to the next question. Sometimes people say, oh, it's just so expensive to go to the dentist, and they don't go. And then their hair is on fire because they have all of these problems. So my thought is, if you go once a year for that checkup, twice a year minimum for cleanings, you will probably, now anything can happen health-wise to anybody, right? But you're probably spending a lot less money in the long run with maintenance. So please help me out with this.
Well, with men, I give a wonderful example. You don't go get an oil change when there's smoke coming from your engine. It's a lot cheaper to get an oil change than a new engine in the car. So less stressful, less painful, and the money. So
yeah,
it's just maintenance. It is. You take care of your teeth. In the long run, they'll take care of you. But it especially in our practice, and this is our fourth practice opening up. We retired for 2 years, and we decided to just do it all again, only because we really love what we do, and we love educating our patients. And we always welcome anyone to come in and just come in and ask us a question. It doesn't have to be about, a fee or a bottom line, because thankfully we're at a position where we'd like to help people, and we'd like them to have their questions answered without worrying that, they're going to get given this big bill. Sometimes that's really, a fear factor too, is just going in there saying, okay, no, this is going to cost me more than my roof, Right. And that's daunting, So coming in, asking questions. Dr. B has large TV monitors in our operatories that he explains everything. He has, a past of being a professor at Northeastern Dental School. So, he loves that. And I love it too. And we appreciate doing that for our patients and our community.
Yeah.
Well, in our time off that we did take, she says 6 months, 2 years, but we really took about 6 months off, and we started working locum tenens in Florida. And we realized that there's a need for dentists in Florida, not corporate dentists. There's a need for people that sit and listen to you. You're not a number on your forehead. People that actually hear what you have to say, review history with you, and not just get you in and get you out. We just don't work like that.
Yeah, we wanted to just administer care. That's what we want.
And education, because with education comes prevent. And prevent is what we were talking about. Preventing heart problems, preventing expensive work. A filling's a lot cheaper than a crown and a root canal.
Yeah, and so that's the thing. And that's why going for a routine checkup, if people put something off, if they say, gosh, you know what, it's been a few years since I've gone to the dentist, then if they had gone, that little tiny cavity could have been, addressed